Along with keeping the patients warm, we also do testing on a regular basis during surgery, and basically it's monitoring. We want to monitor the individual for their oxygen, for their pulse rate. We use two primary sensors here in our surgery, and basically this is an illustration of the pulse ox and the pulse rate. This top number it says 96. That's me. I've got it hooked to myself, and it tells me that my oxygen rate or saturation rate is 97%. As it gets below 90, in both in people and animals, that's when we start to get nervous. Pulse rate is going to be the active pulse rate shown below. Right now, my pulse rate is 70. On dogs, we don't put it on their finger, we actually put it on their tongue or on their ear. And this works very well in dogs and in cats. Along with oxygen saturation we also use a Doppler, and basically a Doppler is a very sensitive type microphone, and it's applied to the inside wrist of the dog. What it does is it picks up the actual peripheral or the blood flow in the lower blood vessels that are going to the hand or to the foot of the dog, and we're able to actually hear that audible sound of the blood flowing through the arteries. This gives us an indication, because just of the sound that it makes, it gives us an indication of how strong the pulse is, still how rapid or how slow it is, and the force of which is pushing through the blood vessels. If the animal were start to get in trouble, then we would have a good indication by those sounds changing. We began talking about when we anesthetized a dog or anybody's pet, that for surgery we also pass an endotracheal tube, and again this tube goes down their trachea. Now this is to make sure that we have an open airway and we can supply oxygen and the anesthetic agent in order to keep them asleep. Keep them totally anesthetized. Anesthesia, again, is the process where we give them medications, anesthetic agents, and oxygen to support them during surgery, and they're not in an awake state. In order to do that, we continue using anesthesia in the gas form. This is the tube that's in the individual. We'll actually hook this to this Y tube, which goes to the anesthesia machine. The anesthesia machine is actually controlled by a vaporizer, which controls the amount of anesthesia that they get, plus the oxygen flow, and this is what keeps these individuals that are on the surgery table anesthetized.